Type 2 diabetes begins with insulin resistance, where cells in muscles, fat, and liver don't respond properly to insulin. In normal function, insulin acts as a key that unlocks cell receptors, allowing glucose to enter the cell. In insulin resistance, these cellular receptor locks become defective, requiring more keys, that is, more insulin, to function. Insulin resistance develops gradually, often due to several contributing factors. These include genetic factors, excess visceral fat, sedentary lifestyle, and inflammatory processes. At the cellular level, insulin receptor signaling pathways become impaired. This impairment prevents glucose transporters, known as GLUT4, from moving to the cell surface, which is necessary for glucose to enter the cell. As insulin resistance progresses, the pancreatic beta cells initially respond by compensating. In a healthy state, beta cells produce adequate insulin to maintain normal blood glucose levels. When insulin resistance develops, beta cells initially compensate by increasing insulin production. This is an adaptive response to overcome insulin resistance and maintain normal glucose levels. However, this compensation eventually fails as beta cells become exhausted and begin to dysfunction. Beta cell dysfunction involves three key mechanisms. First, there's a decrease in beta cell mass through apoptosis, or programmed cell death. Second, there is reduced insulin gene expression, resulting in less insulin production. Third, the cells show impaired insulin secretion in response to glucose stimulation. Several factors contribute to progressive beta cell failure. First, chronic hyperglycemia itself causes further damage to beta cells through glucotoxicity, creating a vicious cycle. Second, lipotoxicity from elevated free fatty acids contributes to beta cell damage. Third, islet amyloid deposition forms in and around beta cells, further impairing their function. These factors collectively lead to progressive beta cell failure, resulting in insufficient insulin production relative to the body's needs.